Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my oh-so-fresh and clean, recently laundered co-partner, Dr. J. Calvert.
I had a different plan for this outfit, but there was some Caesar dressing that got involved, and so I'm in scrubs.
Good thing you carry scrubs with you, all the time, in the car, just in case. You never know.
You never know when you got to operate. Never know when you need a clean shirt.
This is so true. Well, I'm glad you're here today. We've had quite a day of fun, and we're wrapping it up with a podcast session because we have some things we really need to talk about.
It was fun. We should mention that we were at the USC faculty meeting this morning,
yes.
Bright and early.
Bright and early.
We both got there only to, have to talk about the aesthetics rotation and what it means to the program. It was good.
Right. I should say it's a Saturday. We're still sort of figuring out our studio situation. But yes, you and I are both volunteer faculty for USC, and we have the aesthetics rotation that the residents come through and do, and then obviously we have the fellowship as well. But part of being that volunteer faculty, we go to the meetings and we discuss the program and the residents, and it's great. It's a good thing to be involved in.
It's good to teach the residents, that's for sure.
Yeah. But today, what we are talking about is something that I realized we've actually never really addressed specifically on this podcast, and it is the unsexy title of back fat. There's no way of spinning that, really. Sean, you're going to have to, figure something out. But yes, the fat and the skin on your back, and it can be a little bit, it can be mostly skin and a little bit of fat, it can be a lot of fat and no skin. And so how we address that is actually a little more complex than it might seem.
Well, this is like a bra induced thing, because I don't think it looks that bad. The back fat is you have some, it's near your armpit, it's up over your...
We're really talking about the upper back, I should say that. Upper back. So if you're getting more towards the lower back, that's more considered like your flanks.
Yeah, love
but
handles,
anything
flanks.
Sort of at the bra line up to the shoulders, this is the area we're talking about right now.
And all it takes is one bra size wrong and it's misery.
And it's there.
It's just misery. It's like this poof that comes out over. Men don't have this in general because they don't wear bras in general. I don't know. Maybe there are some that do.
The bro.
I mean, I always go back to that. Always feel I could use a little support. But yeah, the reality is that it does bother a lot of people, especially women, and there are guys that want their back fat sucked. Also, it's they want to get rid of it, and there's suctioning and there's cutting, and yes. I'm definitely much more a fan of suctioning than I am of cutting.
I like them all in the right person.
Exactly.
So I think what we have to distinguish between is the difference between fat and loose skin. And
True.
I will say that this area, the upper back, the back in general, is probably one of the first areas that women will experience loose skin of their body, assuming they haven't had babies and have loose skin of their stomach. But in your mid to late 30s, you can start to see that the skin of the back just gets very loose. And sometimes people mistake that for fat because they can actually pinch it and kind of move it around. They're like, oh, I can pinch it. There must be fat there. And then I go and examine them and I'm like, it's mostly skin. So sometimes it's just loose skin, and loose skin in this area can be a real problem, especially if you're wearing a bra and you look in the mirror and all of a sudden you see these rolls coming up around the bra and you're like, but there's not any fat there. It's skin. It's skin that's loose and extra. So it can sometimes be just skin, or it can be skin and fat. And in younger women, it can sometimes just be extra fat and they have great skin quality. So you have to sort of identify where on the spectrum these patients are, because each one of these issues has a different way of treating it.
Dr. Rovelo, it sounds like you're saying you need to make a diagnosis. Is that what you're saying? Because
that's what I'm saying.
Often skipped in aesthetic surgery, isn't it?
Yeah. You have to make the diagnosis, and to do that, you really need a good exam. You got to feel the patient, you got to touch their skin and assess the quality of it. So let's talk about the most easily treated of all of these, and that is the patient on the younger side that has great skin quality. It's nice and tight. They just have extra fat in this area they don't like. What are their treatment options?
I mean, you can certainly do suction. That's, there's surgical and non-surgical. And of course, the surgical treatment is liposuction, and especially if the skin quality is good. What you're looking for when you liposuction somebody, you don't necessarily want to just, go willy-nilly and take out all the fat, because then you will get saggy skin. And then you've emptied the bag, but the bag doesn't necessarily shrink down enough to give you a nice contour. These operations are totally oversimplified on social media, in any sort of reporting about how these things work. There's a lot to it if you want to get great results. And I think that if you're going to liposuction the upper back, you have to kind of say, like, look, it's not going to be super tight and incredible. Like some other parts of the body will do that. Mm-hmm. Like when you suck an abdomen or flanks, they do retract, and you can get really spectacular results. The skin of the back, I think it's because of the dorsal thoracic fascia. And I know that's a mouthful, but it's this fascial system under the skin and the subcutaneous tissue, the fat, is it doesn't have a whole lot of give to it. And I think its blood supply to the skin and the ligaments in that area make it a really complex area to do any kind of liposuction or body contouring. Or if you're going to do non-invasive things like Morpheus or Body Tight, again, we have no financial interest in these things. It's a difficult area, and you really have to be clear about what the goals are and what you think the result is that you can get with the bra fat.
Yeah, and I think in the person that's young and has good skin, I think you can get really good results with just liposuction. You really can empty this area out. And what I typically see a lot of are women that might otherwise be normal body weight or on the slim side, but their upper body is just larger than their lower body. And they feel like they're larger than they actually are because they usually have broader shoulders and they carry their weight in their upper arms, their chest, the sides of the chest. We call that the axilla, sort of the side of the chest between the breast and the back. That's called the axilla. And so there is fat in the axilla, there's fat in the upper arms, and there's fat in the upper back. And most of the time, these patients just want to be smaller in that entire area. And I think you really have to hit all of those areas to affect the change that I know that they're asking for. Maybe they're just saying my upper back because they can't conceptualize what it is they're asking for. But usually it's that constellation of fat in those areas that needs to be addressed in order to really see a shrinkage of the upper body. And again, that young patient, great skin quality, this could be a great operation. You can really take down, their shirt size, even sometimes their bra band size, just by doing the liposuction alone.
You're talking about sort of like husky women, like sort of the linebacker body on otherwise.
I didn't want to use that word, but
husky? I'll say it then.
Linebacker.
Linebacker.
Because it just doesn't seem nice.
But that's what, they'll say that.
They will say that. They will come to us. The patient will
come and say, 100%. I look like a linebacker.
Yes,
like this, my shoulders are broad, my, back is wide, and it doesn't look cute.
And it doesn't match, because usually they have a more narrow hips,
right.
Kind of trimmer on the bottom, and they want to match. They want to be proportional.
So this operation is part of that kind of approach to getting things to look prettier, smaller, tighter. But let's go to the next level, which is now you have loose skin and you got the fat.
Yeah, so now you have the patient that definitely could benefit from some liposuction, but either genetics or just a little bit of age and time, their skin is loose. And I'm going to say not super loose, if they're not like a weight loss patient loose, but they're, in their 40s and they have some loose skin. In this patient, if all you did was liposuction, you may make some of that loose skin worse, or you just might not make it better. You can get a little, and I have seen a little bit of tightening with just liposuction alone. And I've actually seen it really significantly help the rolls that you can get in the back. And so in photos, it can definitely look better. But if you were to sort of hold the skin and play with it, you'd be able to tell that it was still quite loose. And then when you put on a bra, you still see some of the looseness that forms around it. So what is your preferred method for these patients?
I like to send them to you. That's sort of my thing, because
my treatment is Dr. Rovelo.
I don't really like to make incisions. I mean, so
we're not
back
at
in the day,
yet. We're not at incisions yet.
Well,
if you don't want to do an incision, what if you don't want an incision? What's the next option?
Well, I mean, obviously suctioning and then doing some sort of skin tightening therapy with it, either a Renuvion, laser lipo. We have LipoEase from Alma. I am a luminary for Alma lasers, and that does work. I find the Renuvion does work. You can do body tight with it. That's a Morpheus-based technology. All those things will help
to some degree.
Yes.
But I do like offering them. If I have that patient that has any kind of loose skin issues, but not enough that I want to make any kind of incision on them, then I would definitely offer like the Renuvion. Provide some kind of radiofrequency energy at the time of liposuction. You can also do body tight as another modality. Follow it up with some external Morpheus. Like these are all energy-based treatments that can help tighten the skin. Do they tighten it as much as a surgical excision would? No, but I think they are a helpful thing to add if you don't want to put an additional scar on the body.
I think they work. I mean,
think they work.
Again, this comes down to making the right diagnosis and evaluation, because if you just do this for, people that it's obvious they need skin excision, they're not going to be very happy. So you have to just kind of really, you got to know what it is that you can get out of these technologies along with lipo, and then if they're the right candidate, they'll be happy. If they're not, then, and I always kind of sell it this way to the patient, where I'm like, look, we can do this with the Renuvion, we can do this with Body Tight, but if it doesn't get you what you want, then we're going to have to come back here again, another operation. It's on you, it's not on me. And we're going to have to cut the skin away. And in an effort to avoid the scar, they'll usually agree to that, because the next level that we're going to talk about is doing skin excisions across the back, which I'm interested how you like to do that.
Yeah, so now this is the patient either who's just a lot older and their skin quality is just very poor from age and time, sun damage, or this is a patient that has historically lost a lot of weight, so the massive weight loss patients, which we are seeing more and more of with all of the medical things that we can do for weight loss. These patients really have a lot of extra skin. And I have had a few of them that did not want any additional scars. And they said, can we just do the Renuvion? And I give them the exact same spiel that you did. And they come back because their skin they have way too much skin for a cutesy little, Renuvion device to be able to address. And so if you're going to actually remove the extra skin, there's a couple different terminologies here. It can be called a bra line lift. And what we're talking about is an incision that's literally placed in the bra line. And what I do is I have the patients come on the morning of surgery with an old ratty bra they don't care about. I put it on them. I mark where exactly the bra sits on them.
Does it have to be a ratty bra?
Yes, because it might get a marking pen on it.
Oh, okay.
Yeah, so yes, it has to be. It can't be like the new fun one your husband just bought you. It has to be like a ratty one. Because it'll get marking pen on it. And so I mark where the bra sits.
Why not bring a pretty bra? It's just like, I need a ratty bra.
I need a ratty bra that you don't care about. And then once I have where their bra sits on them naturally, then I mark where I want my incision to be. And it's in a location that when they do wear a bra afterwards or a bathing suit, it is hidden. But this is a scar that literally goes across the entirety of your upper back, exactly where your bra line sits. And then if it's just a bra line lift, it kind of goes around the sides to the breast, and that's about where it stops. But it can also be combined with an upper body lift, which is a procedure which is more towards the massive weight loss patients, and that typically includes a breast lift. So this is a full 360 incision around the upper body. It goes around the back where the bra sits, around the sides, and then gets incorporated into the breast lift incisions. And so these are very real incisions. It's an incision across your back. But the results are amazing. They are amazing. I can take out feet of skin, multiple feet of skin, just pull it up, cut it out. It looks, my gosh, the patients love it. They went from having all these rolls and things that come out of their bra and their clothing to a smooth flat back at the expense of a scar.
Right. You have the scar that looks like somebody tried to saw you in half. Other than that, it's great. And you know what though? You're trading skin for scars. That's the reality. And if you like the skin and you're cool with it, as opposed to having a scar and being, snatched and tight, then you have to keep the skin. But if you want to get the skin off, it's a scar that's got to be the trade. And the thing is we can work on those scars.
Yes,
they're there though. I do not sit there and on my website I typically put those scars in the photos at 2 or 3 months, so they're red.
Yeah.
So that the patients can see, because they'll get better, but I'd rather them say, like, I'm going to have a scar all the way around.
Yep.
Yes, you are.
Yes, you are.
Because it's never going to go away. It's always there. And so you have to know that's the trade.
Yes. And for the most part, my massive weight loss patients are okay with that because we've usually done a few other surgeries at this point, and they know the drill. They know that to get their extra skin removed, they're going to have scars, and they're okay with that. It's a little bit harder sell to the older patient that isn't a weight loss patient that's like, you want to do what to me? Yes, it's the trade-off of what do you want. That being said, yes, you have a scar, but if you put on a tight dress, the contour is great.
Yes, it is.
So, again, it's what's most important to you. It's a great surgery, but it does have its trade-offs. And
I think there's a lot of, not that everybody needs to get tattoos, but like I see a lot of creative ink.
That is true.
Around these scars.
Yes.
That, it kind of like, it's like things look nice and then there's a scar. Well, maybe we could decorate a little bit and just hide it up, and that seems to work. I mean,
I like that. That is actually
I do. I think there's, a lot of creative. I got to get some ink myself, but the reality is that there are ways to make the scar tolerable to really get that great contour. I mean, the contour is like, you go from having all this excess skin that's just not what you had in mind. No. It's like you can live with it. You can, but when it's gone and it's like nice and clean.
Yeah.
The patients love it.
They love it. They really do. So in the right patient, the well-prepped patient, it's a really satisfying surgery. And then I think to sort of round off our topic here, let's move around to the front and talk about, I don't even know what to call them, the bra bulges, bra fat. It's those little poofy bags in the front, like kind of where the armpits are.
Or the armpit and the
armpit and the breast meet. Yeah. And there's just these little
axillary fold.
We call it the axillary. I call it the superior axillary fold. But like in, I don't know, layman's terms, it's bra fat.
Everybody wants it sucked out.
Oh, they hate it. And there is composed of a couple different things. Again, fat and skin. So you can have the patient where there is actually fat, and those are very satisfying patients to do some liposuction on because you can really suction out those areas. And it's usually not a lot. It's like 10 cc's, 20 cc's, sometimes 40 or 50. But it's not a lot, but it can be improved with liposuction. It's when it's just skin that it's a little bit trickier. Although I have found that sometimes just running a liposuction cannula under there a little bit kind of helps stimulate it to tighten up.
Yeah, and that's especially where I like laser or Renuvion. I think they add a lot for that area because you don't want to put a scar there.
No, absolutely not. Yeah, no. That's
not cool.
You don't want to do that unless you have an actual ectopic breast, which is breast tissue, which can sometimes form in that area. Sometimes you do need a scar up in that area, but in general, liposuction here works really well.
You are the ectopic breast expert.
We're not. No, I am not. Period. End of story.
How many of those have you done in the last month? It's like every time I got ectopic breast overseaters. Now I got to do an ectopic breast overseaters. I was like, did you open up a website for ectopic breast tissue?
We don't need to advertise this.
So if you need ectopic breast tissue removed, here's your girl, Dr. Millicent Rovelo.
I'm just going to kick you right now.
One day that will happen. I'm far enough away. I think I'm safe. I don't know that you have the reach.
No.
All right.
One day
you got those boots.
I know. Got these.
Dang. All right. I'm gonna
back
shield
away
a little bit. Got it.
The other thing, this is the one area I will concede works well for, is Kybella. Kybella is an Kybella. It's Kybella.
I know Kybella, but you're saying it works for where?
For bra fat.
Really?
So
I've never done that.
Kybella is an injection that's designed to dissolve fat. And it does. It actually does dissolve fat.
Of course.
But
it's FDA approved and it works.
In the process, it dissolves for under the neck, under the chin area. Sometimes people would like to try this instead of doing liposuction under the chin. And it dissolves the fat. In the process, you swell up like a bullfrog, and then you have to come back another 2-3 times. By the time you finish your treatment session, you've swollen up and down a couple times. Your skin's kind of taken a beating, and you're still kind of swollen, and you paid as much as you would have if you had just gone straight to liposuction. True. So for most surgeons out there, we don't do Kybella under the chin. That's for the non-surgeons to dabble with. But in this one particular area, I don't hate it, especially in the patient that really doesn't have a whole lot of fat to suction. Kybella works not bad. And it saves them, any kind of procedure.
Well, I learned something today. I wouldn't have ever thought to inject Kybella into the
Kybella in a small amount.
Axillary breast bra thing.
Bra fat. I got to find a name for
it.
I don't know.
Yeah, it's not cute.
We don't like it. Good names.
Yeah, that would be a
podcast.
good name. That would be a good thing to name. I'll think about that. I don't know what it. I don't really want to name it because I really don't want to have to treat it. So
I'm going to send them all your way. Payback.
It's going right with your axillary breast practice that you've opened. Your specialty center for axillary ectopic breast tissue.
Yes. So
just saying.
I think that's it. These were not particularly sexy topics, but they are useful because people ask about them all the time.
I deal with it on like rhinoplasty. It's like, oh, by the way, while you're there, could you suck my bra fat out?
Yeah, and then you have to go through this whole conversation of like, well, there's fat and it's skin and it's not as simple as you think it might be.
It's not simple.
Yeah.
No, it's really complex. And really in the end, I think this is what, we really harp on this with the fellows and the residents, that, you have to make a diagnosis of what the problem is. And if you can make a good diagnosis, then you can come up with a treatment plan that'll be effective. It seems like I shouldn't have to be saying that to doctors, but you do, because aesthetic surgery, they just think liposuction or excision or whatever. And it's all about the assessment. I think, that's what when you go to a plastic surgeon that you really have confidence in, it's because they take the time to really assess things, make a good diagnosis, and then come up with a treatment plan that's going to get you good results. It's not cookie cutter, and it's not a factory, and you don't just sign up for lipo and get it on your bra fat. There's a lot to it.
There's a lot to it. I'm glad you said that, because it's like I feel like I do get that a lot. Kind of how you referenced. It's like hey, by the way, I get it with my breast reductions. Oh, while you're there, can you just do this? And it's like, yeah, actually I can. I absolutely can. But this is a whole separate procedure. It involves position changes, sometimes 2 or 3 different positioning changes in the OR, which adds time, which adds complexity. It's not a simple like, oh, can you just suction this while you're there? Like this is a full-on real procedure. It's not an add-on per se. So patients need to know that like this is like a big deal thing, and it takes some assessment and takes some time. The recovery for this, it's going to be similar to any liposuction procedure that you have. If you have straight liposuction or the liposuction plus Renuvion or some skin tightening, you'll be in a compression garment for 3 to 6 weeks, some limitations on your activity, back to normal life, regular activity within several weeks. If you're doing the full excision and we're actually putting a scar, you're looking at a 6-week recovery for heavy lifting, any kind of strenuous exercise. But they're all outpatient surgeries. You can usually go home the same day. A little bit of pain and discomfort, but they're not an intolerable procedure by any means.
Yep, and usual risks: infection, bleeding, scarring. Need for revisional surgery. Those are sort of the but it is pretty low risk. I think the biggest risk is that it doesn't work well. I think that really is. I think it's just you have to have that conversation and manage the expectations of your patients so that they can at least realize that if they don't get what they want, that they have to kind of go up the ladder. Yeah, exactly.
Yeah.
Nice.
Excellent. Anything more on this, Doctor?
No, I think I've exhausted my knowledge on bra fat for the day.
And who would have thought it was a whole podcast? Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.